Hello, Kavas. I just want to make a short video of the ozone therapy procedure that I'm doing at home. We're actually at our cottage right now because we're remediating our home, so things are kind of scattered, but this is basically what I do. I grab a tray, I prep everything before I start. I started with butterfly needles, these ones, 25 gauge. I have boxes of them. I order most of my medical supplies from allegromedical.com. They seem pretty trustworthy, and everything comes like in 2 or 3 days, which is nice. Sealed, not, nothing to like worrisome. Rubbing alcohol, needles. I have gloves. The suitcase down here where I keep all my syringes. I'm really bad at videos. And then I kind of, the old ones, I'll, store them in an empty bag. So I either use a 30cc or 60cc syringe. I started off with just doing 30 like a month and a half ago, and then I worked my way up to 60. I got sealed bags of saline. So what I would do is clean off, take this part off, little plastic piece, wipe it with rubbing alcohol. I would take a new syringe, put a new needle on it, pull out 60cc, and I would put it into my beaker, which I got from Longevity. You can use this beaker for ozonating water, olive oil, saline. I've only done it for water and saline. Haven't done anything with olive oil as of yet. The settings are 1/8 for 15 minutes. The protocol I'm following is written by Saul Pressman. He had an ozone clinic for about 15 years. A friend of mine who has healed herself from Lyme, doing ozone therapy, shared this protocol with me. It seemed pretty simple. No drugs, no heparin. It's just saline and with ozone in it. So my ozone equipment is down here. Let's see if I get this set up right. There's my oxygen tank. I'd set it at 1/8, and then I have all my ozone equipment in a drawer down here. And let me see if I can. This should work. Okay. So once I have the beaker filled, I'll put sometimes 120cc in it because it's easier to draw it out with a new syringe and a new needle. I put the beaker down here. I keep my ozone machine in this bottom drawer, and at home in a bottom drawer, to keep it dust free, and so the animals and nieces and nephews don't mess around with it. So I would turn the setting at 1/8. Turn on my oxygen tank. Let my oxygen tank run for about a minute. Connect my oxygen tank to my ozone machine. It puts out the ozone. The ozone goes into the top silicone tubing of the beaker. The bottom one goes into the destructor to keep other gases from going into the saline. So once I have that set, I turn it on for, there's just extra tubing and stuff back there. I turn it on for 15 minutes. I have a self timer. I think it's in the other room, but I'll turn it on. I'll let it run for 15 minutes. Once I'm done, I just have water in there now just to show you guys, because I wasn't going to do the procedure today since my veins aren't really cooperating anyway. Turn it off. You want to unplug everything. Make sure your oxygen tank is turned off completely. Since I've been out here, normally I keep this tucked behind here just so that it's safe and kind of out of the way. I don't want it to be knocked over or anything. once I have my ozonated saline, let me see if I can open this. Maybe it'll be easier here. I normally do this at the kitchen counter, but since I'm not very good at doing videos, I'm just staying right here. I would put a towel out. Before I use saline, I always keep a bag in the refrigerator, so it needs to be cold, because like if it's cold, it holds more ozone. The settings, I guess, I was told and briefly researched that the Russians said that you know, ozone only holds up to about 40 gamma, so you can't really go much higher than that. You can't really do it much longer than 15 minutes. That's not going to harm you, but I was told and read that 15 minutes, like around 40, 45 gamma, 15 or 1/8 are the settings. Once I have this, I would take my syringes, a new syringe, a new needle. I would take this off, kind of away from my face, just because some of the ozone gas comes out. And then very slowly, I would put the needle into the beaker and pull out the 60 cc. And then usually there's a little bit left over, but because of the shape of the beaker, it's hard to get it, like if you only put 60 in, 60 out. So I always put a little bit extra in. In between uses with the beaker, I kind of keep the cap a little bit off of it so that it doesn't, so it can dry out, and then I put distilled water in it before I put the saline and I rinse it out. Once I have a full 60 cc filled, then I was either doing, a while ago, I would take the cap off. I would do it very slowly to make sure there's no bubbles in here, so you don't want any bubbles, and then, you know, if there is one at the end, you know, you want to make sure you tilt it off and get the bubble out. I would attach it to the butterfly needle, or what I was doing the last couple of weeks, which was really promising, was these hep locks. So I would attach it to an adapter. Since I am more doing the hep locks than the butterflies, I'll continue on as if I was doing, if the hep lock was on my arm. I'm not putting the hep locks on myself. I'm having a nurse do it. Either my sister or our neighbor who went to high school with my mom. She's got 25 years of IV experience. So the hep lock would be on my arm. We would use, you know, a bio patch, which is, I don't even know what a bio patch is, but where did I put them? Oh, right here. Okay. Bio patches, caps, lots of caps, route-cleaning alcohol pads, tape. So I would attach this. So if this part was on my arm, I would attach this onto the hep lock. This would be full, and then I would slowly push it through. I would wipe off the end tip before I attached it with rubbing alcohol. Once I pushed it all the way through, I would put this in my bag of used syringes. And I forgot a major part. Before I would put the saline, the ozone saline through, I have these, they're saline like flushes. So here's like an open one. So I push like, just like a third of this or less through the IV line to make sure that the vein was still open. Most of the time it was. There was one time it wasn't, and then I just knew I had to pull the hep lock off because if it's not in the vein, it's not in the vein. You can't do anything about it. So you flush it before you put the ozone in, the saline through. You flush it after you put the ozone and the saline through to clean the line. And then you always want to make sure you have a new cap to put on it. If I did not use saline, ozone saline, for a day, I would still flush it and then put on a new cap. So, you know, you want to clean the line every day. You want to put a new cap on every day. And I think that's about it. I have, you know, supplies of all the hep blocks and all the butterflies, but my skin has just gotten tougher and it's not taking to the needles very well, so the pack line would be very beneficial. You know, I'm only doing about 60 to about 90 ozone saline. I have the flushes to clean the line. I have the bio patches are on it to, once the hep block is on, the nurse would put the bio patch on, like around the needle before she would put the dressing on. I have extra dressings, but obviously if I had a pick line, I'd get the right kind and all the proper stuff I'd have to get. And I think that's it. I have gloves that if someone else, you know, when I'm pulling out the ozone, you know, I'll put the glove on. Whenever we were putting on a butterfly or hep block, that person would always be wearing gloves. And I think that's it. Oh, and then when I'm done with the needles and stuff, right now I'm storing them in this container, so I kind of have a box starting like, you know, up to here of needles. Some of these are attempted tries and it didn't work out, but it has been going well, and it's the only thing that I've really seen any improvement from. As far as more energy, I've been, you know, very debilitated with chronic fatigue and don't really see friends and don't really go out much at all, so it's really been devastating. But I take this very seriously, and proper care, and my full-time job is really to make sure everything's done properly and sanitized, and just, you know, not taking chances. I want to do this right and carefully. So I think that's it. I just want to make this video. Hopefully it's not too long, so you guys know what I'm doing. If you have any questions, you know, we can talk about it. I just want to make sure I covered everything. Alright, I think that's it. Thank you.